You bought the monitor. You're checking it regularly. But here's the brutal truth. If you're measuring your blood pressure wrong, panicking at false spikes, or blindly following outdated advice, you might be doing more harm than good. Today, we're going to set the record straight and teach you how to take full control of your blood pressure, your heart, and your future. What blood pressure actually is. Before we get to the mistakes, let's get clear on what blood pressure actually is. Blood pressure is the force your blood exerts against the walls of your arteries as your heart pumps it through your body. It's measured in two numbers. Systolic, the top number, the pressure when your heart contracts. Diastolic, the bottom number, the pressure when your heart relaxes between beats. So, when you see a reading like 120/80, that means your heart pushes blood out at 120 millimeters of mercury and rests at 80 millimeters of mercury. Here's the kicker. Your arteries aren't just passive tubes. They're dynamic. They expand, contract, and adapt to whatever your body is doing. Exercise? They tighten up. Resting? They relax. That's normal. Blood pressure only becomes dangerous when it stays consistently elevated, even during rest. That persistent pressure can wear down artery walls, damage organs, and increase your risk of heart attack, stroke, kidney failure, even cognitive decline. How most people measure blood pressure. Wrong that 150/90 you saw this morning. It might mean nothing. Blood pressure naturally rises when you're stressed, moving, or even just talking. Measuring right after a jog, during an argument, or while scrolling doom-filled news. Expect spikes, not because you're sick, but because you're human. Here's how to do it right. Sit still, legs uncrossed, feet flat. Rest your arm at heart level. No coffee, food, cigarettes, or conversation 30 minutes prior. Rest quietly 3 to 5 minutes before hitting start. Always use a validated upper arm monitor, not a wrist cuff. Measure twice daily, morning and night, and log the average of 2 readings each time. One reading doesn't define you. 5 to 7 days of structured measurements, that's data your doctor can actually use. The panic spiral and how to avoid it. Millions end up in the ER every year for one reason: fear. They check their BP during a stressful moment, see a high number, and assume they're dying. But here's the clinical truth. If your blood pressure is 180/120 or higher with symptoms like chest pain, blurred vision, severe headache, shortness of breath, or numbness, yes, that's a medical emergency. Get help. If you're symptom-free, sit down, breathe, wait 5 minutes, then remeasure. Temporary spikes aren't disease, they're signals. Learn to interpret them, not fear them. Sodium, the silent agitator. Salt is essential, but most of us aren't just overdoing it, we're drowning in it. That harmless bouillon cube, it can pack over 2,500 milligrams of sodium, your entire daily limit. And don't be fooled by fancy salts. Himalayan pink, sea salt, truffle-infused unicorn dust, they're still sodium chloride. Your arteries don't care about branding. Where the real danger hides: processed meats, canned soups, frozen dinners, restaurant meals. Start checking labels. Aim for less than 140 milligrams per serving. And when cooking, use garlic, vinegar, citrus, herbs. You won't miss the salt, you'll just miss the damage. The potassium advantage. Potassium is sodium's biochemical rival. It helps relax blood vessels and flush out excess salt. But most people don't get nearly enough. Best sources: sweet potatoes, spinach, bananas, avocados, beans, yogurt. These foods do double duty: lower sodium load and raise potassium levels. And no, potassium supplements are not a shortcut. You need it from food. Lifestyle is the real medicine. Medications help, but they're not magic. Blood pressure is rooted in daily life: what you eat, how you move, how you sleep, and how you react. Here's what moves the needle. Weight loss. Just 5 to 10% body weight loss can lower BP significantly. Exercise. Aim for 30 minutes of brisk walking 5 days a week. Stress management, deep breathing, mindfulness, less doom scrolling, sleep 7 to 9 hours. If you snore or wake exhausted, get checked for sleep apnea. Alcohol and tobacco. Limit the first, eliminate the second. Pick one thing, build from there. Artery supporting superfoods. Let's get tactical. Leafy greens, spinach, arugula, Swiss chard, rich in nitrates and magnesium. Berries. Flavonoids that reduce oxidative stress and support vessel elasticity. Beets. Naturally increase nitric oxide, relaxing arteries. Oats. Beta-glucan fiber improves vessel function. Garlic. Allicin improves blood flow and arterial health. Fatty fish, salmon, sardines, omega-3s reduce inflammation and clotting. Dark chocolate, 70% plus cocoa. Small doses improve blood vessel function. Supplements. Support, not solutions. Not everyone needs supplements, but when you're deficient, they can help. Worth considering, with your doctor's sign-off, magnesium. For those with low dietary intake, relaxes vessels. CoQ10, antioxidant that supports mitochondrial energy and can modestly reduce BP. Omega-3s, fish oil if you don't eat fatty fish. Other daily habits that matter. Hydration. Dehydration can raise blood pressure. Drink enough water. Deep breathing. 5 minutes of controlled breathing lowers stress and BP. Consistent sleep schedule. Improves circadian rhythm and cardiovascular resilience. Digital boundaries. Constant alerts equals constant tension. Log off sometimes. Micro movements. Stand and stretch every hour. Circulation improves. Stiffness fades. Myths that sabotage progress. Let's crush a few common lies. I feel fine, so my BP must be fine. Nope, it's called the silent killer for a reason. I'm cured because I'm on meds. Wrong. Meds control BP. They don't cure it. Only old people need to worry. False. Hypertension is hitting younger and younger. 130/85 is close enough. Even mildly elevated numbers increase long-term risk. Natural fixes are all I need. Not always true. Some people need meds, no matter what. Final thought, take the wheel. You now know how to measure BP right when it's an emergency, how food, stress, movement, and sleep influence heart health, which myths to ignore, daily habits that compound. Every small change builds momentum. You take back control one step, one reading, one choice at a time. Tell us in the comments, what's your first move? Hydration, beets, 10-minute walk, deep breathing, commit to one, inspire someone else. If this helped, hit like and subscribe. Thanks for tuning in, and remember, take care of each other and be well.